Well, I first met George about 40 years ago when I joined his board at Central Health. George had come to Lynchburg from Tennessee as president of Virginia Baptist Hospital. But shortly thereafter, he presided over the merger of our two hospitals, Lynchburg General and Virginia Baptist. Well, George is a passionate and driven individual, particularly when it comes to health care. Well, in managing our single independent health care system, he's obviously had to preside over providing outstanding services to the community in health care. And that encompasses the full range, and of particular note is the Strubont's Heart Center that George presided over with Al Strubont's major donation and the development of really a world-class cardiology area. It's just an example of what he's done in healthcare. I would say, George, you've been a major leader in our community, and the community owes you a tremendous debt of gratitude for that. And for that, I personally thank you and have enjoyed knowing you and having friendship with you, and particularly skiing with you where you were undaunted in your courage of taking on the most rigorous slope on the mountain.
So George is a Lynchburg icon, and so I knew of George before I actually knew George. And in fact, George Dawson is just a creative thinker and a problem solver. But I really got to know him in 2012 when he joined the board of the nonprofit that I actually was leading at the time. And it was pretty transformational. I mean, I always had a very strong board and great leaders, but it was really an honor to have George serve on that board and bring his influence into the impact we could have in our community. George brought a vast amount of experience that he had built over the years, I'm sure, being a business leader in our community, and brought those skills to the table at our board meetings. That his ability to navigate a complicated topic or conversation, his ability to find a path to success was extremely appreciated and made a huge impact in the work that we could do. And thanks to him, more people have access to quality health care in our community, regardless of where they live. More students have access to scholarships and wraparound support with fewer barriers in their way. All members of our community have access to exceptional artistic performances while sitting in any seat of the House.
I met George originally probably in late 1984, and I came to Lynchburg to give a lecture on some work I was doing at the University of Virginia, which was on heart attacks. And after that lecture, I was taken to a room and got to meet George. And then I found out a short time later they were looking to start a cath lab in Lynchburg, and I was asked to participate in that endeavor. And so I worked with George very intimately in multiple roles, and worked with George not only from the standpoint of being a physician and being a cardiologist, but also from leadership roles in the medical staff, being on the board of directors. And then as we developed into a friendship as well. George was very dedicated to the community, and George wanted the community to have the best health care they could have. He wanted people to travel as little as they had to. He wanted to do things locally wherever we could do it well. He was very dedicated to the patient experience. He was very dedicated to quality. He realized that he could not get things done unless he had buy-in, and so he worked very hard to have that buy-in. He was always looking for ways to do better. Very much a Renaissance man. And if you talk to George today, it's not about the good old days when I was the CEO of Centra. He barely talks about that. When he talks about, he's very proud of his art, which he should be. He's won numerous awards for that. He's very proud of his family. He is always active. He always is doing something within the community. So I want to thank George for everything that he has done for our communities on so many levels, not just healthcare, but by raising the standard of living for all of us. And so we all owe George much more than we'll ever be able to say.
Back in those days, it was country. So I lived in Great Falls, and I milked the cows every morning before I went to school in Herndon, and Dulles Airport wasn't built yet, so it was a pretty different place, but it was a great place. When I graduated from college in 1968, just about everybody went into the Army one way or the other. And that started me out in hospital work, hospital administration. I was assigned to the Medical Service Corps, working in hospital units. In Vietnam, I coordinated the medical evacuations of patients, first from the northern half, Da Nang, and then later as we consolidated from the entire country. Field of hospital administration, but I thought I would try it in civilian life. So it was to Medical College of Virginia then, now VCU, for my master's degree in hospital administration. I was selected by the board to be the third administrator of Virginia Baptist. Baptist was founded in 1927, built in 24 and opened in 27. And so in 1987, I was hired as the Chief Executive Officer of Centra. I worked at Centra from 1987, when we founded the organization, until I retired in 2012. Well, the wonderful thing about all those years at Centra was the incredible group of people I got to work with, doctors, nurses, other administrators, leaders, board members, and it was a wonderful opportunity from a young guy like me to learn from all those people. Reached outside the hospital walls. We tried to start the Johnson Health Center. We did start the Johnson Health Center, and which later became a federally qualified health center. In the beginning, it was just funded by Centra. We tried to grow primary care. We trained primary care physicians through a residency program. We offered mental health services, substance abuse services. We offered long-term care through 5 different nursing homes. So, yes, I think it's true that clinically we were able to grow Centra into a significant clinical referral center for many people. But it's also true that we needed to reach beyond the hospital walls and improve primary care. I decided to retire about 18 months before the announcement was made. And I felt like I was past my 65th birthday getting up there, and it was time to step aside and allow other people to take the lead. After I retired, or after I announced I was retiring, before I actually had left, my successor was recruited by the Centra board. And after I retired and after I regained my health, my wife Rosemary actually came to me and she said, it's time for us to do something together on my terms. I want you to help me raise money to relocate to Lynchburg Humane Society, because she loves cats and dogs and people. I've also worked on fundraising with the Academy Center of the Arts. I enjoy the arts. I paint. I have a studio downtown and paint, dabble a little bit, I should say. I've enjoyed working with the Lynchburg City School Education Foundation. Jody Gillette dragged me into that, and then from there that led to working with a wonderful group of people to help fund the Dolly Parton Foundation Library, the Imagination Library here in Lynchburg. I feel like one of my favorite quotes is from Mother Teresa, and she said, if we have no peace, it's because we've forgotten that we belong to each other. And I've remembered that all my life. My work in the community gives me peace. It does more for me probably than I do for others. And maybe our community and our country needs a little peace right now. Maybe we need to remember we belong to each other.